Hi, so this video aims to explain which patients are recommended to have a PICO dressing following caesarean section, when the dressing should be removed and where to find further information. The PICO device provides a suction known as negative pressure wound therapy, which helps to draw out the excess fluid from a wound and protects the injured area from getting dirty, which ultimately helps to promote healing. On the ULHT intranet, you can find the Caesarean Section Guideline, which includes the indications for using a PICO dressing. At present, all women with a BMI of 45 and above at booking are recommended to have a PICO dressing. But please be aware that the NICE guidelines have recently been updated to state that all women with a BMI of 35 and above at booking should have a PICO dressing. So the ULHT guidelines are currently being reviewed, and at some point soon it's likely that that will be updated so that our guideline will reflect the NICE guidelines. So please keep an eye out for this change. The ULHT Caesarean Section Guideline also states that we should recommend a PICO dressing for women with 2 or more of the following risk factors: BMI of 35 or greater at booking, if they are a smoker, if they have diabetes, if they've had a previous caesarean section, if they had pyrexia in labour, and if they had a ppH of greater than 1.5 litres. Please follow the website address that we've included in the comments to watch 3 videos. One is about a patient's experience of having a PICO dressing. The second video explains what a PICO dressing is and how they work and what positive impact they have on caesarean section recovery. And the third video explains how they can be applied. Women should be discharged with a PICO information leaflet. These might differ between the 2 hospitals. At present, this is the one that is given out at Lincoln, and at Boston, I think it's going to be an A4 sheet that we have, so keep an eye out for those. So just make sure that they have them upon discharge. It includes lots of information about how the PICO dressing works, how and when to disconnect the pump for washing and showering, for example, and what the different pump alerts actually mean and how they can be rectified. The ULHT Caesarean Section Guideline states that PICO dressing should be in place for 7 days and then should be removed after this. If you have any further questions about the PICO dressings, please speak to a member of the education team and hopefully we'll be able to help you, or speak to one of the managers on the wards.